Whereas in the comparison area, without this community program, the poor women, only 30% of them received care, and there were great differences between rich and poor.
The remarkable changes which CARE has brought about in Bangladesh are not unique to that country. Hear what Jody Winterhoff, CARE's VP for Policy and Advocacy, has to say about what CARE is doing in Peru.
Nearly every minute of every day, a woman dies during pregnancy or childbirth. These deaths disproportionately affect the most vulnerable women and children in the poorest countries.
We've even started a signature program called Mothers Matter. And the reason we've done this is, when you understand the statistics and the challenge that basically almost every minute a woman dies around the globe from these complications, and yet we know some of the answers and we know the interventions that work. And so we want to employ more of those interventions around the globe in broader ways than we have so far to really save women's lives.
In the southern highlands of Peru, maternal deaths have fallen dramatically.
We really went in there and worked with the community, and there was significant reduction in maternal mortality, almost 50% in approximately 3 years. Really extraordinary statistics. But what really made that story powerful is that we also worked with the health minister and helped the communities work with the health minister to adopt those interventions as the policy of that region. And then we helped them take it to nearby regions and help them take it across the country.
CARE worked to ensure health centres were attended by skilled staff who spoke the local language. Cultural preferences like giving birth standing up were respected.
I think that, to me, what's special about maternal health is it's not all medical, it's not all technological, it's not all healthcare. That the changes that we bring to communities include improving equity, increasing social justice, changing some of the harmful gender practices and gender norms that exist within communities. So the work that we do benefits not only women at the time that they're pregnant or before they become pregnant, but benefits women in so many more ways and benefits entire communities.
What I believe I hear Ben saying is that CARE's 21st century strategy for aiding the impoverished empowers women and thereby benefits the entire community. Let's get another perspective on this by going vicariously to East Africa with the help of Michelle Carter, CARE's Country Director of Operations in Burundi. Michelle was one of the panelists at the Washington Conference.
Good afternoon. As we go from the global, the conceptual, to the factory workers in Bangladesh, I'd like to take all of you to Burundi and take a small example that I think much of what has been already said is demonstrated within. Burundi is one of the smallest countries in Africa. There we see all of the cultural barriers that have been discussed here. It has been a country fraught with violence for many years due to civil war, but also violence within the homes. There's quite a bit of violence against women. There is a high level of polygamy, and many of the cases that we've started to learn about polygamy was that when there was the coffee harvest, there's great coffee in Burundi, when the coffee harvest happened, everyone said, wow, this is great, poor people finally get some money. But what was happening is poor people were getting money, the men were getting the money, they were going out getting drunk and coming home beating their wives and going out and finding other girlfriends. So it had serious impact in the economy because obviously they've also spent their money and they have more family members to take care of. The women are supposed to be at home. Burundi is probably one of the countries with the richest proverbs out there. It's a very oral, there's a lot of oral tradition in the country, and there are often proverbs said such as, the chicken cannot speak in front of the cock, meaning, obviously, well, you get it. Having lots of children is very much valued within Burundi. 6, 8. Part of this is religious, related to multiply and go forth. Part of this is, for agricultural reasons. And part of it is there is just a love for children in Burundi. Some of the other cultural traditions have included And this is starting to erode with time, but it takes 3 years to beat your wife to make her know that you are the master of the house. The men are definitely the head of the household and they control the money. So now that I've described a pretty dire context, I want to explain to you sort of what we've been doing to try to overturn a whole culture. We have been very impressed with the power of microfinance in the Burundian context. It is about, I think just a quick explanation, our microfinance is not microfinance in terms of official banks and all of that. It is a group of 20 or 30 women sitting together, pulling their money together and being able to give loans to each other. CARE does not inject any money in that, it's all training. So on one hand, what we've seen is that women have had disciplined savings, they've had credit so they can expand their businesses, so that has been very powerful. But on the other hand, every week they're sitting down with other women and saying, hey, did your husband beat you last night? So did mine. It's a source of solidarity. It's a source where they can talk, especially because many of them are prisoners in their own homes. So we have found that village savings and loan is the terminology that Karen uses, but these solidarity groups, this small community-based microfinance system has been very powerful. And Goretti is a perfect example of how this community-based microfinance can change a woman, not just in terms of giving her economic value, but giving her the space to talk to other women about their problems and finding solutions.
Let's meet this Goretti that Michelle is talking about. Here she is in Washington for the conference with an interpreter. How did you first encounter CARE?
What I learned from CARE is trainings which allow me to speak out about my life, and I learned from CARE how to save and how to get loans to do some small business. That's what I'm doing now, and it's allowing me to get some money what I couldn't get before.
And I gather that has changed your lifestyle.
What I learned allowed me, for example, to do planning, family planning. Before I was giving birth every year and I got 6 children still young. Now I am 36 years old and I have stopped to give birth. From that time I got family planning. I learned also how to do loans and credit. I'm running a business, I'm getting some money, and I can pay what I need in my house. And I am more respected by my husband because of that.
Goretti shared a sharp observation with Michelle Carter, the Burundi country director, who told us this story at the conference.
This woman, comes from a small village in Burundi, and she's traveled on 4 flights to America for the first time, not having left her village very often. And one of the things we keep asking her is like, what are you going to say when you get back to your village? And I thought she was going to say, look at the planes, look at the buildings, look at the fact you have electricity, look at all this wealth. She said, well, when we were in the Amsterdam airport, I noticed men were carrying the babies, because they had the little baby born. She said, I'm going back and tell the men that they can take care of the babies too.